2019, the first cases of a novel coronavirus was detected. That was the start of the COVID-19 pandemic. The event sent ripples across the globe. Ripples we're still feeling today. And for all of us, it was a challenge. But for our healthcare workers and professionals, that challenge was even more insurmountable. My name is Ryan Funk with Multicultural. Together We Can is a series where we sit down with healthcare workers and professionals to hear about their experiences during the COVID-19 pandemic. Today with me is Sylvia. Sylvia, thank you for joining me today.
Thank you for inviting me.
Of course. Your insight is what we need to figure out, what was this like? For lots of us, we just heard about the information going on from the outside, from the news, but you lived it. You were in those trenches.
I sure was. And the stories I could tell.
So how about we just start a little bit with what you're currently doing?
Okay. Well, currently I'm the Communicable Disease and Immunization Manager for the Winnipeg Regional Health Authority at the Central Team, so for public health. So that's my role right now.
Mm-hmm. So I guess just during the pandemic, what were you doing?
I can tell you exactly what I was doing. Okay. Honestly, so where this all began for me, and I knew Corona was started in 2019, but when it actually came to Canada, when we started to have cases in Manitoba, March 12th was our first case in Manitoba, in Winnipeg, and I happened to be working on call for the weekend starting the 14th. So as the cases were rolling in, the case got transferred to me, and then I ended up doing case contact, interviews, education, beginning on Friday evening. And that weekend, I will never forget how many hours I put in. It was just constant working. Because as soon as we had that one case, then we started getting airplane manifests. We started getting the disembarkment ships coming from LA, Vancouver, Winnipeg residents coming into the province. So we had to contact them, teach them, educate them how to self-isolate, how to watch for signs and symptoms. So we started acting very quickly so that we can try to control as much as we could and contain it. And I think we did a good job, but at the start was pretty touch and go. But that weekend was a really hectic weekend. It was just nonstop calls back and forth between the medical officer, health, to myself, and grabbed a couple other nurses in to help with the support from public health. But yeah, it was so that was the start of it. And then it progressed, right? So after that weekend, they asked for volunteers to join a COVID Central team. I joined this COVID Central team. That team was responsible for doing all the case and contacts in Winnipeg. As you can imagine, we start with 20 to 30 cases a day, then all of a sudden it's 50, then it's 200, then it's 400, then it's unimaginable numbers, right? So, it grew so quickly and the staffing needs were so vast that we needed more people to support. Call center started, the testing site started, we had closures happening, as you know. I was in right in the thickness of it because we were working centrally and I knew what was going on. I had people who had loved ones pass away, and I was offering condolences over the phone. So it was a very difficult time, right? Because we were there, we were experiencing it. We knew people were dying. We knew we were trying to help other people. So it was hard to explain to people. We had a lot of people hanging up on us because they didn't know who we were, because we were, phoning people. So imagine getting a call and saying, hey, I heard you were in contact with somebody in the last 3 days, and
it's who are you?
Yeah, they questioned us. They'd hang up, they'd call back, make sure we weren't a call center and things like that. So we're some solicitor.
Well, for all of us, it's just a situation that none of us expected or would know what to do in. And in Manitoba, as we were starting to hear, the cases around the world, and it started infecting in Canada, it was just how long is it going to take before it eventually hits us?
Yeah, and it was interesting because it kind of worked on its way out from the other provinces inwards, right? I kind of saw that happen at the start, so it's just interesting how it came about. But it was bound to happen, and we did what we could.
Yeah, I know I had some people telling me it's it's not a big deal. It's never going to hit us. It's fine. It's it's going to hit us good.
Yeah,
it's gonna happen.
And it was the waves. Yeah, the waves that can't.
And the waves. So you mentioned that your position changed during your time.
It did. So as our teams grew and we had to we started training people to assist them with calls and contact cases. So we had a lot of things going on, different partners coming in, and we were to help us out. So I transitioned, and this happened towards the end of the year 2020. I became a communicable disease coordinator. So then I was more responsible with the FIT team, so the focused immunization team. So before I touched base on the FIT team, I just wanted to mention December, we were waiting and waiting and waiting for the vaccine to come. We finally had the vaccine. We started, I was present at the first clinic, which was at the Max Rady Center, where we started doing healthcare professionals. So it was just overwhelming to even be present at that moment where we're like, holy, okay, this might be like, this is gonna help us, right? You think that there's a light at the end of the tunnel. So it was very emotional actually even to be at that first clinic. Then we moved, so as I transitioned into my role, which was the focused immunization team, I was then responsible and leading the team with a colleague for all the personal healthcare homes, so all the PCHs. And there's about 39 for the Winnipeg region, so we had to go to all the homes and make sure we immunize all the residents. And then again, that was another emotional day when we first went in there, because these, when we're watching elderly people stuck in their rooms and we're immunizing them, just their response, of course it's emotional, right? You want to help them and you want them to get out of the rooms, you want them to have their family back in their lives, so that's good.
And I guess before the vaccine became a reality, the situation was kind of just like treating, like we got to treat with it when people are sick, you're just trying to get through that situation. I guess just for the nurses, for yourself and the other nurses at that time, what was reality like dealing with a situation when you're like, we don't know when this vaccine is going to come out?
Well, I guess it's just you don't know, right? You just don't know, and you take it day by day. The information is changing so vastly. There'd be information in the morning that would change by the afternoon, so you just had to be with it. I think I was so driven and so focused on my role that public health is prevention, promotion, protection. So it's like, that's my role. This is what I'm going to do. I'm here for this, for the city residents of Winnipeg, and I'm going to help as much as I can, right? So I think we get into this role mode, and we're there to educate. We're there to, teach them, help them protect themselves, and if they're sick, give them the guidance of where to go and support them where they need, right? So I think it's just, you get into this mentality and it's just go. And it was like that for 3 years. It was just go.
No rest at all.
No, there wasn't.
I guess when you're looking around, for some people, working from home was a great experience. They're like, oh yes, finally I can rest. It takes a little bit of the pressure off. For nurses, that pressure never ended. It was always just the go, 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 go. And as cases started to skyrocket, you could see the wear and tear it was having on nurses, both physical and mental health.
Yeah, absolutely. I saw a lot of my colleagues, and when, it was always, we were on edge. Usually in the afternoon, we would get the last report of the day of how many cases were coming in. So that would tell you how many came in, if we're going to go home at 5, at 6, maybe 10. So it just depended on when we were going to be going home, right? So we would always be on edge. Okay, that's how many cases. Okay, divvy them up, phone, do our work. But again, it was always, everyone was living on edge, and a lot of people were affected, sure, mentally. Some nurses unfortunately had to leave the profession. They had to take a break. Just it did get to be too much for them. So yeah.
For yourself, what sort of things would you do to help get through those periods of time where you're just physically exhausted from the day, the number of cases, and helping people, and just you're having to make those calls to family? You never know when you might get infected, unfortunately. What sort of steps did you take to kind of, I don't know, maybe balance yourself through that situation, or at least kind of stabilize yourself?
You know what? I'm always a go, 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 go person. So it is hard. It's hard to settle. It is hard to.
Yes.
But you know what? Just being home and seeing my loved ones at home, I think was good enough for me. Just to make sure that they're safe, they're home. Yeah, schools were shutting down, and seeing the kids at home, even at home doing university online. So to me, it was a comfort knowing that they're home. Even though every morning I had to get up and leave, and I would drive on the streets, and there would be hardly any cars. It was lovely driving to work, but it was like I knew that they were safe at home. So. Yeah, I mean, I'm a different kind of breed out there, so.
Yeah, you're one of those people that are like, all right, let's do this, let's go.
I get it
the
done.
Never stop kind of thing.
Yeah, and I only realized the impact actually on my colleagues is we had a professional development day half a year ago, and one of the topics was kind of our experiences during COVID. And then only at that point where I actually sat and I just saw people's reactions and people, how it affected them personally, and just them voicing their concerns. So that actually kind of hit home a little bit, like, holy, like,
Yeah.
I've been on a drive, and but so many different people were impacted different ways. If they had to shift from what their work they were originally doing, and they were asked to go work in a different department. So it was interesting to see that perspective, and it sunk in a little bit, like, holy, yeah, this was a big thing.
It was a big thing. Yeah, I guess if you're constantly in the, like, go,
Yeah.
sometimes it can feel like things just kind of go by.
Yeah, I mean, you go to work, you do your work, and you go
Yeah.
home, right? So, yeah. But, yeah, I mean, still today I'm thinking, like, oh, I probably should slow down, but...
Slow down, take a moment, take a breather.
Yeah, maybe.
Let's do this. Let's keep going.
It's not my character.
So during this period of time, information was coming and going so quickly.
Yeah.
Every time there would be a press release that you would hear from anywhere in the world, you're like, this is new data, this is new information from scientists. I guess before your leadership position and afterwards, what was those experiences receiving that information? Like, how were you feeling from it? Was like, they're enough? And then afterwards, when you're around the table, transferring that information to others, like, okay, this is all I know, like trying to be transparent, I guess.
Well, just for a perspective, we started with a 12-page document, which was called our guidance document. So that's what we as nurses would use just referencing and how to isolate, what to do, what to watch for. That grew from 12 pages to 30 pages to 124 plus more later. Like, that's just how vast the information is
just some
changing.
light reading.
Yeah, light reading every day, and things would change. Like, they would change a whole section, so it'd be reprinting the information. Like, because I was centrally, I thought the information flowed really well, because we work directly with the medical officer of health in our, for the Winnipeg Regional Health Authority. So that information came from the province to the medical officer of health. Then it was translated to us, and we would have huddles. So I found the information was good with us, but then when we had to transfer the information out to the other public health nurses, it was a bit more difficult because not everybody's there or, able to join in a conference call, or you're sending out the details, and it's so many emails.
You're playing telephone.
Yeah, I mean, there were times where I'd be at my desk and I'd have 800 plus emails in one day, and we were trying to catch up with all the questions and trying to, when I shifted into the role of a communicable disease coordinator, that was part of the roles. It was answering the questions from the public health nurses and keeping up with all the changes and sharing it with the staff. So, imagine 800 emails a day. It was lovely.
I prefer not to imagine.
Yeah.
Imagine that.
Do what you wish.
But yeah, it's such a bizarre situation now, looking back. And I mean, of course, we're still going through some of those effects. There's still COVID cases going around.
Yeah.
But, we've come out the other side. And when we're looking at things, I guess just through this whole endeavor, what do you think we can learn from it? What were some stumbling blocks that we went through? What were some things that you felt like, yes, we were on top of this, was great? And just, from all this information, how can we move forward? What can we learn from this whole experience?
Well, I think the biggest thing was staffing, right? The shortage of staffing.
Mm-hmm.
So, and how quickly we had to work to find workforce and expand our immunization clinics to even include other professions other than nurses to immunize, right? So I think that was a key part. Staff, it was just so much going on, and so many different people were pulled in so many different directions, from the testing sites to the immunization clinics. Yeah, it would be mostly the staffing, how quickly we can get that going and up and running. And we don't have enough people out there to work, so.
Yeah, that's always the trouble, is how can we encourage more people to get in? How do we get more nurses?
Yeah.
When they see everything and people getting burned out, it's not the best way of motivating people to get into the field.
No, I'm sure people retired because they didn't want that stress, right? But then some people came back from retirement, so it just depended where people were at.
I guess we'll see.
Yeah.
Interesting.
Yeah, but other than that, I mean, they say pandemics will happen every 100 years, so I guess it's one for the history books. But collaboration, cooperation, I think getting the teams quickly together and, I thought they did a good job from the background and the vaccines, what I saw, and how quickly they were able to manage that, and the amount of hours that everybody put in. It was a lot of meetings, a lot of constant discussions and changes that occurred. So
yeah, and these are perspectives that the public wasn't necessarily privy to. They don't know how much the meetings and the time that was spent kind of in those at the table.
Oh yeah, and those happen even beyond me as well, right? There were just higher levels that were meeting, and then it was disseminated to us. And as I shifted into my roles, I was actually able to sit at some tables provincially, just with regards to the immunization clinics and with all the regions, and how we're planning all the, from boosters and what's next, or what's the age gap, or just the changes in who can get the vaccine. So a lot of decisions were made and lots of meetings, and it was good to be part of that, and just to be in the middle of it, and you can give your suggestions and help out where you could. Yeah.
Well, thank you so much, Sylvia, for sharing your perspective and taking the time to talk with us.
Yeah, thank you very much.
I'm Ryan Funk with Multicultural. This was Together We Can. Thank you for watching.